have someone just randomly peek on this camera and see if everything looks good right now. Okay, so we're gonna pick up where we left off on the last ribby workshop here. Can you see, is my head cut off?
Is that
Like, right at the top?
Workshop title?
What?
The Ribby workshop.
Ribby stuff, yeah. This is part 2 of Ribby stuff. So last time we only went through 2 manipulations, just like lateral compression, really just trying to restore anterior posterior, like manually expansion. And then we did the ice tong technique, which was more to like reset ZOA and like diaphragm starting position. Have you ever had that done to you by chance?
I'm not sure, I'd have to see it.
Okay, I feel like maybe I did it to you when I like first learned it through PRI stuff, but it's probably been a while. So we'll briefly go through the side-lying rib compression stuff, and then I want to talk through a like clavicular fascial release technique that a lot of people have, like this right side compression in the shoulder, which I'm sure a lot of y'all have probably seen before. Some people just feel sticky here, but some people have that like big heavy right side like collarbone drop that's really visible. It's an easy technique that you can manual people can do on people, but there's some easy ways to stretch to get the same type of thing. So we'll kind of go through that today. And then with time that's left, we'll go through how to self-manipulate ribs so you can teach clients how to do it. Just because there's some people, anybody with neck problems, shoulder impingement, and or, I mean, some people, if you've got people who's like their entire body's just always tight, people who just constantly complain, like everything's tight all the time, chances are their ribs are stuck. And you got to get them to move. So we'll just go ahead and get right into the lateral compression stuff. So you can, I had Scott and Bryson take their clothes off last time, but you can leave your shirt on. And we'll just go ahead and start, man. You can lay on your, have you lay on your left side first, just for camera sake. Probably spin you around when we do the other side. Let's go shoes off just to protect our table since it's getting all jacked up. Perfect. Do you want a pillow?
This is okay.
Okay. So,
You have allergies?
Yeah.
Bryson,
Like 10 times in a row this morning.
can you hand me that blue yoga mat? Austin, I'm gonna have you lay on this.
Nathan,
This
what's it
wasn't
weird that my body likes bouncing on this ball?
You're probably a little weird. You just.
Guilty.
I don't know. I don't. If you had asked me 6 months ago, I would have probably come up with 3 different things to tell you. But I know you. You have a lot of things to do all the time, so you just got to use that energy. Can you raise that up so that way my forehead isn't cut off of it?
Right here.
Where your left hand is or where your right hand is, just unscrew that right there, and then it should just lift up. And just take it up to where it looks like I'm all the way in there. Thanks. Amazon was on sale. It's like a best $40 tripod ever.
It's $40?
$40.
Like it's like $4,000.
Yeah, it was only 40. It was like 190 discounted to 40. So I thought it was gonna be crap, but it's pretty great. There's a couple of parts that wobble on it all the time, and I always think it's crooked, but it works. Okay, so we'll get into this. So if you're doing this to somebody, you got to make sure they're laying on something because you need something to kind of match the compression you want on each side. Ideally, they're going to start pretty stacked. You want the person to be as comfortable as they can be with their head on their arm or on their pillow. Knees need to be bent to some degree just so there's like stability and comfort in the hips and the lower back. Some people will really like to be like knees tight up in the torso. Some people will be more like Austin is right now. It's really personal preference. If you go to do this on somebody and they're just like getting away from you or squirming a lot or just not holding or not relaxing on the table, they probably need to have their knees higher up, but I'm pretty sure he's gonna be fine. So I'm really picky with when I really wanna get the most out of this, having the client's arm up. And all this does is just encourage a little bit extra natural internal compression, not internal compression, but this being up makes this tissue work. So when you have more lift like this and this stuff is naturally working, it's creating more of a barrier on this side. So your expansion is forced anterior and posterior, which is what we want here. They can be, if they're really struggling to maintain it or their shoulder doesn't like it, just let them ragdoll. It's like 95% the same thing, but I really like to have it up. So from here, a lot of people, if you have really, really flared rib people and you're doing this to somebody, yeah, you probably want to have a hand like down here and a hand up here. If it's someone who's just that kind of overall general like tight rib person or someone who's just really wide, just cover your real estate and just get ready to push them. A lot of people, if you really get used to feeling on people when they do this, some people have like this extra like almost bubble that feels like is up here. Austin's just meaty. And he's got a little extra cushion right there. Not cushion, I'm sorry, that's not the right way to say that. He has an extra muscle right there. So you got to make sure that what you're feeling for is the bony stuff, not just muscle stuff. Are you waving at me, Scott?
I have a question.
What is your question?
What's the purpose of this?
The purpose of this is to manually mobilize the ribs and to get better anterior posterior expansion of the rib cage. So for someone lifts a lot of weights, me and Austin like to be meatheads, we naturally get wide and we don't have good anterior posterior expansion, which can get in the way of certain hip mobility and certain neck and shoulder things for some people. So if we're trying to restore rotation in the system or just restore or decrease tension in the body, we need to get better expansion this way so tension can move through the body better. Otherwise, we're just kind of stuck wide.
So I've got a question based on that.
Yeah.
So if it hurts, like I was telling you, it hurts
Yeah.
like that, does that just mean like my muscles are tight, or does it actually mean I don't have good expansion like front to back?
It could be a little bit of both. If you've done it, if it's tight the first handful of times you do it, I would just give it a fair shot and see how it treats you. It could be that what you're laying on is too firm. You might need something softer. It could be that you need to breathe lighter as you go through it. Some people don't need much. Like I've got one client that I do this with that I'll probably only push. I mean, that doesn't feel like much at all, right, Austin? I mean, some people you just kind of guide the movement a little bit because otherwise they'll brace up and they fight it. It could be less is more. It could just be take more time on it. It could be that you need to have your roller specifically in like one place or the other for it to feel less nasty. That being said, if you're laying on a foam roller, sometimes like the long thoracic nerve is right through here. And if you're laying on the nerve and it's just like you're getting an oh shit response the whole time, like good luck. It's just gonna suck.
Yeah.
So you need to find a sweet spot you can tolerate. Any other questions?
Are those new shorts?
No.
Oh, they're nice.
Oh, thanks. Okay, back to this. All right, so let's give Austin a good squish. So do you feel like, just because I know you know your body decently well, do you feel like you're more like wide or stuck wide or expanded, like lower in your ribs, middle or higher? Do you feel like
Probably mid.
probably mid?
Right at the separation.
Okay. So do you want to move this a little bit lower on you?
That's probably the most bulbous part of my ribs right there.
Bulbous, that's the word I should have used earlier. Okay. Shimmy back towards me just a little bit. That's all you need. Okay. So roller on the most bulbous part of you. So keep that just a little up for me. Okay. Don't force your breath. I just want enough inhale that you feel like there is some expansion. Go ahead. Hold it. I'm going to put compression. Now as he exhales, he's going to roll with me. So internal rotation here exhale creating internal rotation. The inhale, we're going to work with external rotation. Something popped in there.
How hard do you press it?
Hard enough to feel like the ribs are actually moving underneath my hand. Really the big thing is I just want to make sure I push hard enough that I feel that the ribs have to give and move a little. Like that one right there, I felt the upper move a little bit better. Exhale longer at the bottom, not forcefully at all, but just like you're trying to get out that extra air, or let me push out the extra air.
And for the non-manual therapists, they can do this on their own somehow?
Yeah, I'll show that next, or towards the end of this. Exhale. I think you're a little tighter on the upper part, man. Inhale from there. So sometimes I'll hold people in this really hard compression point here, so they kind of have nowhere to put air except like center anterior and center posterior. Some people it doesn't really do much, but for some people you'll actually like feel like their back pop or rib pop. You good? One more inhale.
What percentage of your people do you do this with?
My neck and back people, I would say probably 85% of them I'll do something like this with. Generally, my clients, I probably do something like this with 60% of them, depending on what they have going on. I've got some people who come in for rib and knee or hip and knee problems, and I'll work their ribs like heavily in the first few sessions, just because it's like they're so stiff up top. There's no way they're going to get anything moving down below because everything's locked up. Just remember, all your movement starts proximally. So if you can't move proximally, whether it's pelvis or ribs, and you're trying to do something with the lower body, like you got to get movement through the body. Otherwise, you're just working with a brick wall. You want to flip over?
Yeah.
You feel like I could have pushed you harder?
Oh.
Oh yeah. Okay. So hold on. Flip. Put your head on this side. Do you feel like you're more bulbous on the left side or the right side?
Typically, it feels like my left is the one that's.
Okay. So I'm gonna really get on top of you on this one.
Aye.
Okay. So we're gonna be up. Now you need to scoot forward because I'm gonna get up on the table. Right there. Bryson, we're good on the camera?
Do you want me to move it to like center it more, or just keep
Yeah, whatever makes it look good. This will go on YouTube. I got a bunch of people watching these videos on YouTube right now, so I'd like to try to make it look good. All right, are you ready? Okay, take a breath in. I'm just gonna crush you on the first one, no rotation.
There's a disclaimer to not literally.
Inhale, roll back. Yes, please do not crush people, to break them. Exhale. And you do want to guide the ribs in and down to really close that rib cage. Inhale, just guide them back. Remember, this is just external rotation. We want expansion. You want to kind of see breath fill the body.
What if they're very necky breathers and they're using their neck a lot in this? Do you care or not really?
I just try to get them to breathe softer.
Yeah. Silent breath.
Yep.
Low effort. There's a difference between big and effort.
Yeah.
I find a hard time sometimes getting people to understand, like, I want you to take a full breath and not go
Yeah.
make it happen. So,
And like he said, usually just silent. Like if it's silent, it's usually way softer. And if you see them like they're just, it's like they're, I mean, you'll see the neck. Like it'll tighten up and everything. You just tell them to lighten up. Like you usually need, I don't know, I feel like most people probably need, what would you say, like 60% of what they think a full breath is? Maybe 70%?
Yeah.
And then,
and when they kind of figure out how to do the soft full breath, they'll actually get more air in.
Mhm.
It just doesn't feel as forceful.
Mhm.
And so like that force and like kind of contracting everything feels like, ooh, I get a lot. It's
Yeah.
a big breath. But if you like have them test it like a balloon
yeah.
and they do a normal breath, you'll get more out of it. So.
Have y'all heard me say the phrase, you can't fight tension with tension? Like that applies to breathing so much. I wish I could say that was my phrase, but I got that from somewhere. I want to say I got that from David Gray. Yeah, I think it's a David Gray thing. But like it's just with this type of stuff and anything breath related, like anything range of motion related, you can't fight tension with tension. Like same thing with stretching and stuff like that. Like a lot of people handle low intensity stretching really, really well. What you looking at, Scott?
Your body looks very balanced right now.
Thanks. Been working on it.
So
Okay.
do you not like tails and rails anymore? Like for
Couldn't tell you the last time I did pails and rails. I'll do one-sided isometric stuff for certain things, but I don't remember the last time I used the phrase pails and rails or supersetted stuff back and forth. Yeah, I mean, if I use pails and rails, and I don't even want to use that verbiage anymore, but if I do something like that, it's like 20% ISO, or it's more for like the motor control or neuromuscular control, where I have like, say me and Austin are using his shoulder, and like it's just, things just don't organize the way you want, so I'll have him just like be a statue, and then I'll just be like, resist me, and then we switch, resist me, resist me, resist me, resist me, and I'll do that in different sections. Totally off topic from what we're going on, but I just don't use it the same way.
There's a bit of a difference between, let's say,
I like the banter back and forth.
so like the weighted toe touch that I do on the cable stack.
Oh yeah.
The weighted toe touch is hip flexion, right, and spinal flexion against load. But the reason I do it is to improve, well, not only your hip flexion, but people can find their hamstrings that way better sometimes when they have something to work against. That's different than like the tension with tension thing. So you're using the closing side to pull you into a bigger stretch for the opening side. Would be different than like the neck breathing. If we're trying to create room to expand or move into a new area, but we constrict everything, it's just not going to work very well, right? That's what we're talking about. That's why sometimes like we use like the inhales on the descent of a squat, because it gives us a little bit of that expansion of the pelvic floor and gives you space to move down and into, versus the natural habit of like, if you're going to lift heavy, you don't even have to tell kids. Kids will do a Valsalva without knowing it. They'll, or they pick up something heavy. They're doing that to create tension, to limit their movement options so they can put more force where they want to, right? There's a difference, right? So I don't want to make people think that like, if there's any kind of tension or work being done, like some kind of mobility exercise,
Right.
that kills your mobility, but it's where you're generating it, right? Someone with low back pain will frequently be a butt squeezer, like pull it under them, tighten up their backside, because they're afraid of their back. So they're bracing, but the thing that they're bracing is the exact spot that they need to open and move through, the back of their hips. So that's fighting their tension with tension, and those people are gonna be like, and they're gonna feel their back a lot, because they
Maybe-
didn't.
I was gonna say maybe a better way to say the phrase is you can't fight tension with excess tension.
Yeah.
Like there's a spectrum, there's a
Yeah,
scale for
that's
sure. And I think it's safe to say too, everybody's tolerance to that is different. Like some people, like at first, if you're dealing with pain, like your thresholds are low for that stuff. But if you're dealing with someone who's just like tight and they're trying to get strong, like you just gotta kind of figure out the sweet spot. Like how much can you load them where they can still move and breathe comfortably without like, you know, like just bracing like crazy. Is that? Do you agree with that? Yeah. Okay. Cool. Okay, so nothing super fancy on this as far as the lateral compression stuff. So if you're gonna do this on your own, let's go ahead and we'll get into like the self-treatment side of this to do it on yourself. I'm just gonna get you a foam roller, and we'll just go from there real quick. Do you want me to leave you the mic? Do you have any comments or
No, I'm
concerns you want to talk about? Okay.
I'm gonna leave it.
Okay. I knew you were gonna start talking.
What does that do to the shape? Made it wide, right? Wide objects don't rotate as easily, right? Right. So I don't know what you guys know about motors. You know, there's spinning compartments in motors. That if the object is big and wide, it takes a lot more energy to rotate it, and then you have to balance all that mass that's swinging around. Or an example that most people have seen is like a figure skater when they spin. How do they start? When they're spinning slow, they're wide. Their legs and arms are out, and then we want to increase their rotation speed. They tuck in towards their midline. Tucking in towards your midline, if it was just your rib shape, would be like that. And now I have a round object that spins with much less inertial resistance at the edges, and it's all centered and it spins easier. That's one reason you might want to uncompress somebody front to back. There's superpowers in both directions. Like I can turn a little better like this, but I can probably stand more compressive forces like this. You know what I mean? So anyway, that's all.
You're so smart.
Like, that makes sense. You want to be
I'm
able
so glad you're here.
like you want to be able
Yeah.
you want to be able to move in like whatever direction you want to move in and not be restricted.
I mean, we've said that a few different ways, but basically, are you moving that way on purpose? Do you have control of your shapes and your postures and positions you can put yourself in? And variability is going to be your friend. If you have more options, you'll probably be more successful at whatever you're trying to take on. You know,
It's like Frankenstein versus Chris Farley. Frankenstein, he can't rotate very well.
No, he can't.
But Chris Farley can.
he could do flips, bro.
That's true.
He could do
That's
flips.
true.
And he's round.
Very.
I think another good like comparison on like the body types and why they need it. Like think of like a bodybuilder. If you ever saw somebody who like a bodybuilder guy try to swing a golf club, I don't know if y'all have seen that before.
Not so good.
It doesn't go very well
Something
at all. It doesn't go well at all. So just like that, wide, like exactly like he said. Like if you want to be a better rotator, you got to compress. You got to come back into your midline so you can actually twist. And we'll leave it at that. Do you want to be the dummy for this, or do you want to go?
Yeah, I'll try that.
Okay.
No.
So I know since Austin is someone who is a little bit wider and someone who could probably uses a little bit more input to return to his midline or to contract in. I'm going to use the PVC pipe for him. Hopefully it doesn't sink into this. I think it'll work.
Yeah.
We'll make it work.
Pretty stiff.
So this is if you're doing this on your own. So you're just going to lay on it. This is probably a little small for him.
Has that been here the whole time?
I have a container over there in the back that's got like 6 of these in it. I teach with them whenever I go to the workshops. I have a go bucket over there of stuff. So when you're doing this, you want to find, I'm going to stick with that word bulbous because it just creates such a good visual. But you want to be on either one wherever you've told the client their sweet spot is, or wherever you feel like you're the widest or the most stuck. If you ever do like a side bending stretch and you kind of find one spot that always like rips on you real tight, that's probably a good reference point of where this might want to be. It could also be like if you go to stretch and maybe you feel low and you feel high, but like this middle part you never feel, maybe that's where you need to find your compression. There's different, I would just explore with it if you're doing this on your own, but if you do it with a client, hopefully you can guide them as they do it. So if you're doing it on your own, this is where you want this arm up. Kind of like I mentioned before, just holding your own arm up causes some low-level muscular engagement on this side that allows there to be like a natural compression on here, so you'll drive a little more anterior-posterior expansion. So from here, hopefully that wasn't uncomfortable.
Does it matter which way the arm is? Like,
I mean, not really. If
this
I would say probably, you know, if this is like neutral and that's fully externally rotated, probably somewhere in the 45-degree range. It doesn't need to be super picky. You can cue somebody to very lightly protract and reach this up. That may help a little bit, but like for some people it's too much of a brain game.
Yeah.
Don't worry about that. So for this one, you want to start a little bit more rolled back. You gotta try to feel like your hips and lower body are relaxed as you do this, and you need to try to feel like you melt around your roller. So you would inhale here, softly, just letting air fill in. The exhale, gravity and your body weight are what roll you forward, and you just let the air fall out of you until you feel like you've naturally compressed or shrank or melted around the roller. Your inhale itself is what just rolls you back, and I like to feel like the upper body rolls back a little more than you think. And then again, your exhale just rolls you forward. And you have to feel like that roller is actually helping you to squish your ribs in. And that's where it can get really uncomfortable for some people. When I do this myself with a foam roller, I'll do this for like 2 to 5 minutes straight. When I do this with a client, I only do it for like 4 to 6 breaths on each side, because usually it's uncomfortable, they don't have the tolerance, and they're trying to coordinate a new movement for them. So I don't do it for too crazy long amount of time. You want to do the other side to even out, or you good? It's up to you.
No, let's go ahead.
So both sides where it feels stickiest is where you
Where it feels stickiest, yeah. Also, it's a good like lat serratus, you know, mobile. It's work. It's a good manual work on yourself. I've over the last I think 2 years or 3 years, I got really like anti-foam roll. I've done more foam rolling in the last like year than I think I've done in the last like 4 years combined. Just work your stuff. Let things get worked on. You probably need to go a little slower going forward. So I think for you, if you take a bigger inhale here and you hold your inhale, I'm a firm believer in holding the inhale like holding your internal stretch. So as you exhale, there's more of a relaxation response, more chance of you actually manipulating your body to close. And then for someone really tight, I may have them kind of stay in the internal rotated position or the closed position for the first part of their inhale, and then really feel as though the bubble actually guides them to open. Because sometimes it's like you start inhaling and you move too quick, and I want the expansion to actually open you up. And then the inhale and decompression to actually close you in. And that's where like mind muscle meditative mindset comes in, and you know, being able to control yourself. Austin probably would benefit. This is a 3-inch roller. He'd probably do better with like a 4-inch roller, I would think, unless that felt good for you.
I mean, it was good pressure, but it probably could have pushed me up a little further to create that
Yeah.
shape change.
And so for you guys here, if y'all ever want to use these, I've got, like I said, I got like 5 or 6 of them over there, maybe 7 of them. This little blue mat rolls around this really well. And then you can beef it up. It's still pretty firm, and then you can really work a lot of good stuff with that. Cool?
Yeah, if they're not very meaty people, they won't like that.
Yeah.
Without some cushion.
Even people who like are meaty, like this, even the foam roller is still,
It's sensitive bits in there.
yeah.
So
Which I just tell my people it means you should do it more, honestly. Okay, so from here, thanks, Austin. I want to do the manual hands-on techniques. I'm just going to show one other technique for today, and then we'll do more of the self-treatment stuff on how to do this on your clients or yourself. Does anybody here feel like their right shoulder flexion is extra sticky? You do? Cool. All right. Are you just testing, or are you raising your hand? Okay. All right.
how's it look? Is this good?
Do it again. You're wearing a jacket, so I can't tell, but I'm assuming based off your range of motion. Honestly, I bet I could do this on all 3 of you guys.
Shay's the worst.
Shay's
Great, but her shoulder.
Shay's the winner? Okay. All right, so this is very, very common on the right side. I think I do this probably like literally 10 to 1, right side to left side, due to natural asymmetry of the body. So Shay, lay on your back, head on this side. I'll get you a pillow, maybe. Bryson, can I get that pillow over there? And then, so you don't hate me too much. Let's take the shoes off, and then you are gonna have your knees bent and feet flat. And Bryson, we're probably gonna need to adjust the camera here in a second. I'm gonna be like here, working on her. Probably, yeah, whatever gives you a good angle over here. So, PRI is where I learned this from. I think they call this a subclavius release technique, subclavial fascial release technique. It's, if you just think of, do y'all know where the subclavius is?
Subclavius.
Subclavius. So, subclavius. So, sub, think below, clavius, clavicle,
Like a submarine.
like a submarine. So, underneath the clavicle. So, this subclavius muscle is fairly medial. Like, if you think like the inner half of the overall length of the collarbone. Most people, you can kind of feel it. So, if you get, okay, whatever looks good. So for most people, like you can feel it. If you get on the like the most visible part of the collarbone and go under, you can feel like that little gap. And then if you go more in here, you can feel there's a little bit more like meat there, kind of. Shay's got little collarbones. But there's a muscle in here. When you do this to somebody, you want to, your thought is you're going to be dragging tissue until you feel that like stick and pull. Can you feel that right there? So I'll do this to each one of you guys just so y'all can feel it. I know Scott loves to be touched when he's here. It is. Okay, so just so y'all can see this, when you do this to somebody, your whole hand is going to be like on here. I use the lateral portion of my hand. I kind of get on collarbone. You're going to take skin down and then really plant and push everything over. Y'all, client and practitioner, should both feel the stop and tug. You can tell it's there, right? So if you do this to somebody and all you do is push down, like you're actually going to not help what you're not going to help at all. It's actually going to just further compress what you're trying to expand. Part two of this is we're going to pull the arm. So it's a hand pushing tissue down, and then the other hand is actually trying to pull the, we'll just say the whole shoulder girdle like away. So you're creating a, literally trying to peel things apart right through here.
What's the title of this?
Subclavial release technique. It's typically subclavial fascial release technique. I might be butchering that. If I remember right, PRI uses this for people who have what they call superior T4 syndrome, which just think ribs like 4-5 or 3-4, somewhere in there. They get kind of like compressed together. So you'll get this high superior compression where the top 3 or 4 ribs drop down, and then the lower part ends up like flared up. So you get this compression around T4-ish. Some people they don't feel much through here. It correlates more in that like nasty rhomboid right side back spasm thing that I'm sure y'all have all felt before. Sometimes it's a rib thing that needs to be released, and sometimes the subclavius is a player in that, but it's not always a part of it. This is just a piece to treating superior T4. This is not like the technique for superior T4. Okay, Bryson, move around if we need to. All right, so if you're doing this to somebody, make sure you're comfortable. So I'm going to have Shay scoot over a little bit more just so I don't have to reach over too much. So as I said, lateral part of the hand right across collarbone. You're going to put a little pressure down just so you can engage the skin. At least that's what you're thinking. You're going to push that down towards the chest and then over towards the sternum. So it's kind of like a diagonal push. Shay, you can feel that. Mm-hmm. From here, the left hand is pinning that. The right hand is going to pull away. And that should just feel like we just created more pull. Now the trick with this as you do this is you're trying to really feel like you're up in this high spot where the subclavius and the stuff that attaches to it would be. If you cover all the chest and just squish it, you're just adding more compression to what could already be compressed. So we're trying to really peel apart the layers here. So hand on top, downward, inward push, pull. She should feel the separation. And then from here, she's going to inhale into her right armpit, is how I like to cue it. I'm pulling with her breath. Uh-oh. Exhale. Thanks, Scott.
Keep going, keep going.
As she's exhaling, I'm pushing down slightly to drag more, and I'm still holding her arm in length. As she inhales, I'm going to lighten up on both a little. Just let air come up into this right side. She's going to hold her inhale. I'm going to re-engage. Exhale. I'm holding length on the right arm as I push more with the left to try to create that drag. And then we're going to relax for a second. So, for some people the hand slides, so you do feel the slip as my hand slides on you, so we don't want to slide. So I'm going to get a hand towel real quick. So when you're doing this on like female clients, or if you do this on skin, you're probably going to slide, so you probably want a towel. Heavy.
Try to get it again from you. From this
Okay.
side.
Women who are well endowed probably will also prefer to be covered when you do this on them. Like some people, heavy-chested women, sometimes wear low-cut sports bras, and when you do this, they feel like you're in their business. So when you just get a towel over there, just professionally separates the areas from each other. It just helps you do your job better too. And most importantly, you don't slide. Okay. This is going to feel like it grips a lot more, most likely. You'll probably also feel like I don't have to push down as much.
Where are you feeling for?
Me?
Yeah, you.
So with the towel here now, I'm feeling for how little pressure do I need down into her and over to feel as though I've made the skin or the tissue taut or tight, whatever that word is. I feel like I never say that right. Taut.
That's right, yeah.
You feel the pull there? Probably doesn't feel like I have to push as much. Okay, cool. So that's what we want. Now from here, she's going to inhale. Air should feel like it gets into the upper right chest / armpit easier now, hopefully. As she exhales, I push just a little bit more with my left hand, just to encourage the drag. And I'm just holding her right arm long. So I'm separating, yeah, there you go, shoulder from rib cage. As she inhales, the air goes up into that right chest, right armpit-ish area. Still holding my pressure. Exhale when you're ready. Sliding tissue. She may feel a little breakaway here as things start to move more. When you're ready, Shay, take a breath. Hold the inhale. Exhale. There you go. So you feel how the collarbone lifts a little bit? I can feel it sliding more now. There we go. I don't know if you can feel that glide there. Inhale. And it should feel like she gets a higher bubble in the right side of her chest with the inhale as this opens. As she exhales, I'm just going to get one more little push. One last open. Inhale. And then I'm going to let it relax. So, I don't know if she agrees with me on this, but as I'm pulling and pushing, there's not much like drastic difference in my pressure, right? It feels pretty consistent for the most part. The big thing is like, as you get better with this, excuse me, as you get better with this, you're trying to speak to the body, work with the body, and feel for as it's releasing, because of what you're pushing on and what you're stretching, you kind of take advantage of what's naturally letting go to get more space. I'm not trying to rip her arm off and smash the tissue down to rip it apart. I'm trying to just encourage it to let go in the direction I want. And hopefully that kind of felt like,
I felt like I had a release.
Cool.
Because I just relaxed it.
Not too terrible, right?
No. That's
Some
fine.
people will end up getting like a little like rash, like hickey almost, right here. Like you can just see on her, like it's red, the skin's a little drier right there just from pushing, but not bad, right?
No, it's fine.
Cool.
Looks like there's a dip in there.
Yeah. So from here, now it's a subtle difference, but for some people you'll do this to them and you'll actually see like more space that comes up in here. So from here, if you were to sit up and test your shoulder flexion, you might feel like you get more out of it. You might not.
Oh, yeah.
Cool. Yeah?
For sure.
Cool. Every now and then I do this to somebody and then they feel so different on right versus left that I just do the left side just to make them feel symmetrical.
Yeah.
Usually the right side is what's stuck, usually. If someone tells you they need this on the left side too, that's where I'm usually thinking like, is this somebody who's just a very lifted, extended chest person? Because a lot of those people feel really compressed here because their rib cage is anteriorly and superiorly shifted. They're just extended. So to compensate that, their shoulders will roll. So they're actually forward in the chest and then like down and internally rotated in the shoulders. So there's just compression there. That's a whole different thing you're trying to go after. Cool?
Yeah.
Okay. One of y'all want to go
Sure.
next?
Yeah.
Okay. Who wants to do it?
I go.
Do you want to, one of y'all want to do it to each other, or do you want me to do it briefly to each one of y'all and then y'all try to do it to each other?
Yeah.
Oh yeah, I said it that way.
Either one of those routes sounds
Okay,
good.
just lay down, Bryson.
On my back?
Yeah, on your back. Okay.
Doesn't he need to get naked?
No, he doesn't have to. So since he's wearing a shirt, it's just this. You don't need the towel, because that's your towel. He's already there. Some people who are wearing like, I know, some people who wear like really nice athleisure, like Lululemon, like the really silky tops and stuff like that. I will ask them. I'll tell them what I'm about to do, and just so I don't stretch out their clothes. I have a shirt that I went to go see a practitioner who did this to me, and she like stretched the hell out of my shirt, and I'm a little bitter about it. So ever since then, I just ask. But that's totally a me thing. I don't think I ever.
Very considerate of you.
Well, I
That-
don't really want this shirt stretched out.
It shouldn't stretch. It shouldn't stretch that much. It's more like the stuff that's so thin it like almost won't stick to your skin. It's like you'll be fine. Okay, so I'll go through it quick. I didn't mention this before. Some people, when you grab their arm and pull, they get nervy in their hand from like the tug on everything, just that fascial drag thing. Some people have a really nice ulnar notch that you can hook into and pull on. It feels great for the practitioner, but it sucks for them. So I've realized I do that without realizing it. So try to grab more on tricep. And that usually gives you a lot more meat to hang on to as well. Okay, you ready? So collarbone, just kind of feel for it. And then we just take a little pressure down to pin the tissue, slide down and over. And you just need to feel that tug right there. And you tell it's there. And then we pull the arm just enough to kind of create a little deeper separating feeling, stretch feeling. Feel that? Now from here, you just take a breath in. Right upper chest is where you're imagining air goes. A little bigger inhale. Easy exhale. And as you exhale, I'm just working with your exhale to let my left hand drop into you and slide a little more. And when you're ready, you'll take another inhale. And I just hold the length on the arm. I'm going to let you come out a little more here. And then exhale. It feels like a better engagement there. And then when you're ready, inhale.
It's very relaxing. You go to sleep over here.
There we go. It feels better. Exhale.
How's that feel, Bryson?
One more inhale.
Kind of hurts a little bit.
Good thing you're strong.
And then we'll let it go. So that's what the sensation, that's what you're going for. Everybody's different. So if you were my client and you were like, I can't relax, I can lighten up probably 30 to 40% lighter and still do the same thing. I'm just trying to feel for where is the natural tension of the tissue and beat it by just a little bit. So for some people, you can just barely feel like you're beating the tissue by like 1%, and it's enough. Everybody's different. Was it nervy in your hand at all? Down your arm? Okay, cool. Did you feel that little opening there at the very end of that? Did you notice much?
A little bit, but I think I told you I have like this
Oh, you're-
ongoing strain here.
Yeah.
Kind of like that along here and then in the back too. So I don't know. I have other stuff going on.
Okay.
Yeah.
Was the back of the left side?
Yeah. Just right now, but usually it's the back of the right side.
Back of the right
Wraps
side.
all the way around. Yeah.
Okay. You may be somebody where there's another technique called an infrasternal pump, where we breathe and work the ribs. You might benefit more from that, but we're not going to get into that today. It's super rare. I don't use it on very, very, very many people, so we won't worry about that. Okay, your turn.
I'm a rare breed.
You're special. That's why we like you. So just take mental notes on how that feels.
Yeah, it's a little sticky on the right because right's been weird. So this is good.
And you have neck stuff as well, right? Like TMJ-ish things.
Yeah, probably have a little of all the things.
Is your TMJ stuff more on the right?
This thing's been. Huh?
TMJ more on the right?
When they give you like
Um,
cocktails before they
You ever notice?
calm you down.
I think it's on both sides, but I think I have more compression on the left.
Okay.
It's weird because I wear an ear pod in here all the time, and I just switched, but I think that was part of it. Constant radiation. There's probably a little tumor over here, so now I like to lean this way.
That's where Huberman and the podcasts have gotten too deep. I don't care about that stuff anymore. I used to, but that's just me. I think I don't know. Everybody's system is more sensitive in different ways, shapes, and forms.
Yeah, I
but-
was halfway kidding.
Okay, but halfway still.
50%.
I like.
Maybe not, but maybe.
I recently had a long conversation with somebody who firmly believed that their headphones were like they were really worried about like legit like radiation, like EMG, whatever all the weird stuff is. They're worried about the electromagnetic stuff, like frying their brain, and it was a kooky conversation.
There's probably worse things happening.
For sure. I mean, we should probably focus more on the plastics we eat out of rather than anything else. But that's again a whole different lecture. Okay, are you ready?
Oh.
All right, let's see how Scotty does. Okay, so I didn't tell you this before. You can get a good test on this if you just like palpate underneath the clavicle and just kind of pull. For some people, you go to do this and there's like zero separation of the clavicle actually pulling away from the ribs. If you do this and you go to pull away and like nothing moves and like their whole body comes up with you, that's a really good sign. This person's going to need this. Scott,
Am I moving?
you actually have a good amount of space in here, like over here. I'm curious if you're going to get anything like way more medial, like down in here.
Oh, it's tender.
So we'll see what happens. All right, so grab that
Got you on camera.
meaty tricep.
We got you. I'll cut that part out for you.
Amanda.
That's all right. I had donuts, but here we are.
All
Yeah,
right.
she took her shirt off for a second.
Oh, did you? That's funny.
Bryson.
Okay, you ready, Scott?
Yeah.
Okay, so collarbone, a little pressure on, slide down, and then over and you're feeling for where that like muscle tug is, that tissue tug. You kind of feel that right there.
Mm-hmm.
From there, you're going to pull out and up to get that little bit of separation. That's where you just breathe. As you exhale, I'm just going to work with your breath to naturally push a little more. As you inhale, you're thinking airflow around my hand. Exhale. Inhale. Hold it. A little too big of a breath there. Exhale. Inhale. Exhale. Almost there. You might feel it open up here in a second, Scott. Inhale. Exhale. Let's do one more. There it goes. Exhale. Now one more, just inhale. Okay. Good.
You seen that movie Carnosaur?
What'd you say?
Carnosaur, the movie where the
No.
velociraptors take over the factory.
No.
Well, there's a scene where this guy gets his arm stuck in an elevator, and the dinosaur has his arm in the other hand, and he rips his arm off slowly.
That's what it feels like?
Yeah.
Cool. Okay, test your shoulder flexion, just to see if you notice a difference.
It feels better now. Yeah.
And does your left one just feel a little stickier?
No, left one feels pretty good.
Okay. Cool. And should just, for some people, there could be, one thing it does help too is like if the chest is tight, the clavicles, the subclavius is tight, and like some of the anterior shoulder stuff is tight, even bicep stuff, like just doing this on somebody, like if we just think of the fascial side of things, you're pulling a lot of stuff to open it up. For some people, it's just a technique that's easy and effective to do from the manual therapy side of things to get a whole region to open up. And then for other people, it's so specific to that subclavius, like keeping the collarbone. So for some people, it's so specific to the subclavius or the collarbone actually being like internally rotated and stuck down that like you have to break that loose. But that's that. Y'all want to try it on each other? One of you? Cool. I need a break. I got
I'll
tired.
do it on here. Hey, do your shoulder flexion.
Hey, Bryson, don't look down when you do it.
What's that?
Yeah, just so your neck's more open. Just,
I'm concentrating so hard.
I don't know.
I don't know, I should have it set up so it looks like y'all are just looking at each other in the eyes.
That's good. Do it again. Why do you slow down so much?
Because that's all I got.
Does it get tight at the top? Is that what slows you down?
Yeah.
Where do you feel it?
Here.
Interesting. Maybe, or do you feel it?
So,
Yeah.
I don't think-
Feel more
that's where-
lati serratus
I think
stuff?
That's where I'm blocked, yeah.
Bring it down. Go ahead, come back up. Are you like trying to flex or anything? Just
No, I'm just
No?
trying
Just-
to bring
just-
it up.
okay,
I mean,
just-
without using my back.
okay.
That's what I'm
So
trying
if
to
you
do, I
if you don't try to resist anything,
Uh-huh.
just bring it up.
guess.
Okay.
And using my back, I
Okay.
can- But yeah, if I'm trying to not go into that,
Okay.
that's where I'm.
Okay. I won't say anything. Go ahead.
What?
Go ahead. Try the technique on him.
Oh, I'm gonna do it on the other side. Alright. So we're gonna go here. And here, yes?
I don't think I said this before, but like you use the outer blade to find your pressure point. Try to let yourself use as much of your palm as you can as you get the hang of it, so you don't end up like messing yourself up as the therapist. If I do this like a number of times in a week, if I stay too on the blade, I'll start getting like elbow issues and my neck kind of gets weird because it's like a weird karate chop pressure. But if you just let the hand be flat and let your body kind of like drop weight and push into it, it's more manageable from the therapist perspective, or as the therapist.
Does that feel similar?
Scott, you need to raise the table, man. Here,
Raise the table,
I got
Scott.
you. I got you.
Thanks. Just relax your arm. It's dead. Don't hurt yourself.
So since this is more of a, like, if we think of like a layer on layer like push of tissue, you're trying to do more of a push like this way rather than in. So if your table's low, you're going to naturally drop into them, and you
So
really.
I'm going with the fibers, like this way.
So if we're thinking of like the subclavius being attached up through here, and those fibers are more, if I remember right, they're kind of more vertical, up and down.
So we're going against.
So
the
we're trying to
fibers.
take that down and then away from where it normally is going. Because if I remember right, those kind of go a little bit more
In a way.
in and up, over and up. Either way, you're just trying to come like that.
All right.
I feel like maybe you have a little bit too much pressure down.
Yeah, it looks like it.
Is that
So, Scott, I'm going to raise the table again for you. So, I think if you come a little bit more, let's see, bring his arm up more, grab more on the tricep. Start by pulling his arm out so you get a little like traction this way. Then you won't need as much pressure in and down. And you're just feeling for where does the tissue glide like naturally stop.
I
That's
think I have it.
Does that feel a little better, Bryson?
yeah, like not as much pressure down.
Okay. Do you feel like the same drag?
I don't feel as much drag though.
Okay. So, Scott, you probably need to get more up in there, come down, and then over.
Oh yeah, it feels better.
And then maybe pull my arm a little bit more.
Yeah.
That, yeah.
And then it's just enough to feel like you've got the tug.
Yeah.
And then Bryson, as you inhale, like you would be cueing him to breathe either up in here, upper lateral chest, armpit, or around the hand. Any of that's fair game.
Okay.
As he exhales, you just ride the exhale. So you
And
keep the
inhale.
tension, yeah. And with the inhale, you just lightly hold with a little tiny bit more tug. On the exhale, you maintain this while you ride out the exhale.
Is that comfortable?
Less irritating than what I did.
We were about
Yeah.
to get to the release.
Just because I kind of see it. Bryson, how much are you hooking his arm? Or are you? Okay, just curious. Some people are just slippery, and I'll have a client hook my arm. Sometimes when they hook, it tightens up the arm, and it doesn't release as much. So you just have to experiment with this. For some people, like everything, it just doesn't work. Like you think it should work, you're like, I know what I need to do to you, and you go to do it to them, and like nothing works.
Felt it go.
Did you feel it good?
I felt it, yeah.
Felt a little something, something.
A little something, something. Cool.
Okay, let's see it again. Let's see if it did anything. Maybe a little bit.
So I know mine's super tight. If y'all want to feel what like, this is probably gonna feel like two pieces of leather stuck together. Like if you want to mess with that,
Here, you do him.
do me, Bryson.
Come on, be professional.
We have fun here.
Huh? You can have it. I'm good.
Which side?
The right one. Yeah. I've been like super compressed on my right side.
I needled you that one time, right? In the subclavius?
No, I don't think you did subclavius. Maybe that was left. I don't remember
I thought
actually.
I did subclavius.
I don't remember.
And I was having trouble getting it. And then I finally think I got it.
Yeah, I really don't remember.
Does the table need to come up?
That's up to you. I'll let you figure that out. So I totally forgot to tell you guys, remind you guys, when you are doing this to somebody, you want to try to get their knees bent and feet flat, because it just helps relax the whole torso. A lot of people, when they lay flat, they're already extended. So if you just want to take tension out of the equation, just a little knee bend goes a long way.
Knee bends.
Hold on, let me move my cross before you stab me with Jesus. And make sure, like, I think I'm pretty tight up here, so make sure you find like the collarbone first, and then really take all the.
With this part here?
I think you're gonna be better off
There.
finding it like on the pinky side, like find the bone and then just drag down and over the bone.
Is that the right hands?
Yeah, that's weird, right? I'm not
Yeah,
supposed to
your
use-
hands are backwards.
Yeah, that's why I was like, I feel like I'm in your
Super
neck.
karate chop.
Yeah, that feels way
Yeah,
better. Way
okay.
better. And then I think the palm of your hand needs to be a little bit more.
Yeah, he started me like on the clavicle and rolled out.
Okay. Like that kind of.
Yeah, you should almost feel like you're ending up partially on the sternum
Okay.
when you get down into it. So from there, yeah, I think if you push down a little more, and then maybe a little bit more that way. Yeah, like that. Now from here, you want to figure out how you can kind of use your body as the leverage to
Mhm.
maintain this. A little more down.
And that concentration. Good job, Bryson. How's he doing, Nathan?
He's good. Yeah, there you go. I don't know if you felt that shift.
Yeah.
So that's where, like, once you, like, that was really good, and then the shirt started to slide. So if I was you at
Yeah.
that point, I would give both of us a break and just you would get right back on it.
Uh-huh.
How much of a shift did that feel like to you? Did that feel like
Yeah,
my
it
whole?
felt like it was like pulling. Yeah.
Okay. I think, like, just knowing me, I don't know if you want to go back in and check. If you get back on the collarbone and stay, rather than starting like here, if you start like damn near where it attaches,
Uh-huh.
and it's almost like where SCM, like attachment points are, and then pull from there, like down and in. Probably more like somewhere like right there. I think that's gonna get that last little bit of it. I don't know, I'm just curious if you'll feel it. Because I use the same technique also to get like some of this SCM stuff and platysma garbage on people as well. So it feels to me like most of your pressure is out here.
Okay.
So you need to be a little bit more over.
Maybe move my hand here.
Yeah.
Like that?
Yeah.
Let's move this way a little bit.
That's it right,
Right
there.
there.
Yeah. You feel the difference?
Yeah.
And you'll know when you're, I mean, it feels like just a stop. It's like that dense
Yeah.
tissue pull. Let me look at it. Or let me relax. Just maintain what you got with the hand.
Oh, that looks deep.
give away the last.
You know, it
rep
definitely did. So I think I don't think you need to push directionally as much. Once you once you feel the tug and stop, see how little you can try to maintain it. Because
Okay.
you really don't have to keep going more and more and more. That's why the shirt is sliding.
Okay.
Because you're trying to just beat it more.
Yeah.
Once it starts moving, it usually just continuously lets itself move.
Yeah.
So you kind of have to see. It's weird. You just gotta like let it do its thing, and you're just guiding it. So now I'd be curious, just so you can feel the difference. If you just put your hand up there, don't pull or anything, just like push and see how that skin moves. And I would go ahead and grab my arm like you were gonna do it, just so you can feel the difference now between the side that feels like more pliable on one side, and just how it's sliding just that little bit, and then come over here, and then push this side. Has it been off me the whole time?
I think so.
Oh, awesome. Was it on the table or was it?
It was here.
Oh, okay.
I don't know how long it's been there.
Oh
Though.
well. Sorry, guys. Okay.
Oh, wait, this one here.
Just see if you notice a difference. Just in terms of like how the tissue slides, like density and stuff like that.
No, just skip.
You might not notice much, but
Yeah, I can't say I feel.
the other thing you can try to feel for too is like if you think about where the collarbone is and then where the ribs are, like
Yeah.
what does that distance feel like between coming off the collarbone to the ribs? You can just feel what that drop feels like, and then you can check the other side and just see if you notice a difference. 'Cause you'll do this on some people, and it's like there's almost no gap between collarbone and ribs. It literally feels like the collarbone is a rib, and it's just like, just like how ribs are stacked. It's really weird.
It's a good song. You know this song? From your raver days?
So on that side now, do you feel like there's like a little bit more of a drop off, or do you feel like it's kind of about the same?
I would say like here I feel it, but not so much like there.
Yeah.
I think you just got meaty chest muscles and
I think
Good.
just from how I feel my body personally, just day to day, I think this part in here could probably get pushed down more, based off how it felt with you going back and forth. But that's totally how I perceive it. I'm not gonna like if they feel pretty symmetrical for you.
but I'm not like an expert in like.
Yeah, but I
posturing and
also know
stuff.
like you can't trust how you feel your own body.
Right.
So like I don't want that to be like
What do you think is the thing that needs the most work on
On-
this body here?
on
On
me.
this body.
Lately.
Oh wow, you have like a
Oh yeah. Big O inverted sternum.
yeah, it's interesting.
So have y'all ever seen that before? The inverted sternum
Not like that.
on people?
I've seen, yeah.
So a lot of people with inverted sternums have a lot of weird neck and shoulder stuff because you're missing I have a natural, for some reason my body is concaving when it should be expanding. So that pushes me super lateral, which I firmly believe is one of the reasons that my neck has the history that it does.
Interesting.
So do you work on a lot of the A to P stuff?
I try to, but it's like sometimes it's just, it's like, dude, I've been like this for 30 years. Like I have photos of me as a baby, like very like young toddler with this. So it's like that's where you got to figure out like what is just your anatomy and
Yeah.
what is worth
Well,
correcting.
Not to try to fix it, but
Right.
like if you work on it, it could help expand it a little bit.
Yeah.
Have you found that to be helpful?
Like yeah, when I do the sideline roller stuff, like it helps symptoms across the board.
Helps your neck.
Yeah, it just helps chill everything out. Like I went through a short phase where I really tried to try to push it out, and I would do like little breath holds and try to actually shove it out, and it's just so much work for nothing, and it just feels like you just stress out about it.
I think as the Holy Spirit fills you up, it'll start expanding.
It feels like it's gotten deeper actually.
Oh.
Maybe he's filling you up the other way.
Maybe. That sounds weird. So do y'all have any questions about any of that?
That's good, thank you.
Cool. Okay, so just to do the subclavius thing on your own, because this is some people will not get much out of this. So if you think about, like, for those of you who did it to me, when you're thinking about trying to release that area, the simple exercise solution is a seated landmine press. It's like sitting on a box, like very good looking posture, 90-degree hips and whatever. And then from the side here, you're pushing out at about a 45-degree angle. The torso is still, and you're trying to coach your client to push to the point of feeling as though that collarbone is coming kind of up and off the ribs without the torso going with it. Now, a lot of people when they do this are going to push and they're going to shrug up into it. So that's very different than just a like good palm engagement and a glide up to where they start to actually like lift and a glide versus shrug. It's a subtle difference, but usually you can see the difference and the client will feel the difference. So that's from an exercise standpoint. Great to work in with anybody with that compressed upper chest. Usually with people with the compressed upper chest, a lot of the time you'll see a compressed lower ribs. You can pair the seated landmine press with a kneeling low row and focus on more of the eccentric, because the eccentric is going to help peel apart the lower ribs and will get a little stretch at the top. And then that kind of goes hand in hand with the expanding the two areas that usually are tight together. From there, since we have the rings here, I absolutely love doing this every chance I can. You can do this with a pull-up bar as well. Bryson, I may have you move this here in a second. So I'll use this one. So just hang. This just happens to be the perfect height right now. I don't know if someone did that on purpose, but this is great. Normally I just free fall, but if someone can sit, you'll be able to tell if someone's really, really tight, they're gonna be like this, and that's not stretching anything, you're just kind of cheating around it. But if they can kind of like let the ribs drop, let everything pull away, let their head fall, and just let the whole shoulder kind of get pulled, lifted up and out, and then they just hang out. You can cue hand rotation if you want. You can do this a little bit more like sideways with some people as well. The trick with this is you're not trying to get them to feel like a massive hard stretch. They just need to shift out to where they feel like there's a pull, there's a tug that comes through armpit into collarbone, wherever they can feel it, and then they just breathe. Less is more. Similar like when you're pushing on the client on the table, like you're just feeling for the tension and beating it a little bit. Same thing here. Feel for the length, breathe into it, let gravity do the work. Cool? Easy enough? Awesome.